are live. Flip the camera. Okay. So, hi, this is Dr. Maria Salas, and this is How We Heal with Dr. Maria. We are live today with old Sandstrom. Hi, Jerry. Welcome to the show. And Gunilla.
Yes.
Yes, and you guys are a part of SelfHelp4Trauma.org. Yes, thanks for joining the show. Okay, so what we're doing today is we're going to go ahead and talk about, hi Kenan, thank you so much for joining the show. We're going to talk about SelfHelp4Trauma.org. And I wanted to say thank you so much, Ulf and Gunilla. You guys are coming from Stockholm, Sweden today. Thank you so much for coming on the show. And I wanted to ask you, what is trauma tapping technique?
Yeah, you go, Gunilla.
Yeah. I mean, trauma tapping technique, as we explain it to people, it is a very simple technique for relaxing the nervous system. That means to help your nervous system to go into rest and digest instead of being in fight and flight, or getting the balance between the two. It's a tapping technique which resembles other tapping techniques like EFT, emotional freedom technique, TFT, that was I was trained in originally, thought field therapy. All these techniques like TFT originated then not very far from where you are, Maria, because it was originated in the beginning of the 80s in California by Dr. Roger Callahan. So what we have created, the trauma tapping technique, is a simplified version of all the other techniques, more or less, you could say, meant for helping people to help themselves, and especially then in areas of mass traumatization, like areas of conflict, post-conflict, but also now, like when we are launching this new website and an animated video, especially directed to refugees in Europe and elsewhere. To Sweden, there are many refugees coming, and many of them are, of course, traumatized from the war in Syria. So the reason we are launching this now is because we all need to assist ourselves, but also for these refugees to know there is a way that you can actually calm down those memories of the past, yes, to be able to create something new.
That is a great explanation, and you actually helped with practically every question that I was going to ask you. So let's break it down for the followers. Thanks everyone for who's on the show right now. Again, this is Dr. Maria Salas, and we are joined by Ulf Sandstrom and Gunilla from Sweden. And we're talking about helping people with trauma today, okay? And so more specifically, you both have been working with refugees from Rwanda, and are we talking about anyone, children, women, men?
Yes, we're talking about everybody, because this technique can be learned by anybody, and that is what we have seen through the years, the 8 years since we started working in Rwanda and Eastern Congo, both with refugees and survivors of conflict, also refugees in Sweden, in Finland, also First Nations in Canada. I just came back from there. Everybody who has been through and are still living with a lot of stress, also daily stress. But now we are directing ourselves specifically to refugees, because there is in each country where this refugees comes, there is a lack of help for their emotional state. So we see that everybody needs to be able to help themselves in waiting for professional help,
yes,
or just doing something.
So the way, can you tell us about your website? So there are two that I saw. There's the Peaceful Heart Network, correct? And there is the SelfHelp4Trauma.org. What I like about what you guys have put together there is that you guys are like first aid, just like you explained. You are first. Yes, they're. Sorry, I was trying to answer a question that I just saw. You guys are first aid until the professionals come. Is that how you train first aid people?
Well, let's put it this way. Stress in the nervous system, emotional stress or post-traumatic stress, regardless of what it is something that is invisible and debilitates and extremely painful and can actually stop learning, stop environment. It can create physical symptoms. To wait for professional help when there sometimes isn't is allowing something to just become worse. And there is something you can do about it. There is a first aid, and first aid is for everybody. Anybody can do first aid. It's something you do because somebody needs it. So you could say that we have specialized in non-specialist knowledge. What is there that anybody, even a child, could do to help themselves or a parent or a sibling or a friend when the nervous system doesn't stabilize? Because that's what it is. Traumatic flashback is when the nervous system goes into alarm, and you can do something about it.
Yes, and just like Gunilla explained, alarm is another term that people have heard is fight or flight.
Yeah.
And they get caught up in that negative loop, and it stays there. And so what the tapping does is, what does it do? Is it kind of cut that cycle a little bit?
I think there are a lot of explanations for that. But
Okay.
First of all, you could say the points that you tap on are points that communicate a lot with the nervous system. It's the same points that are used in acupuncture or Chinese medicine. So some points of the body have more nerve ends, more communication than other points. If you tap on the knee or elbow, you don't get the same effect. What you're doing is you're introducing a state of calm physically into the body, and you're also associating with your body, and you're getting a sense of, I am here, I am now, I am not in the memory, I am not back where it happened, which I thought I was just a few seconds ago. And actually, if we disregard the mechanics of it, because there are several explanation models for that, let's just say that anything that relaxes your nervous system when you have a panic reaction or an anxious reaction or an emotional reaction will relax that reaction.
Okay. We had a really good question from the room. Someone said, so tapping on my knee will help with sorry, your question went away. I couldn't read all of it, but will tapping on my knee take away my memories from war? And that's not what they're really talking about here.
No, what we said was, if you relax your nervous system, if you have an emotional reaction to a memory of war, the emotional reaction will calm down. Your memory will still stay. It will still have happened, but you will be able to think about it without reacting emotionally negatively.
Oh, that's okay, Akri. No, I was just trying to get what you're saying. The comment faded away. No, I think that you explained it perfectly for them. Let's see. So one of the things how do we do this? Oh, that's a great question, Rockwider, and I was going to get to that. Well, since it's out in the open right now, do you want to give us a little kind of tidbit of how it works?
Yeah. Gunilla, you can take it.
No, I mean, it is as simple as this. I mean, we can make the explanation like in 3 sentences. You connect to something that bothers you just a little bit, because you don't have to dive deep into it, just a little bit. You just connect to whatever it is that bothers you, and then you tap on these 13 points on your body. The points are on the hand, they're on the face, and on the chest. So they're easy to reach by yourself, or if somebody else is assisting you. So the points are, and if you go to that website, SelfHelp4Trauma.org, there is this 4.5 minute animated video, which shows exactly how to do it. Also on our website, peacefulheart.se, have videos showing how to do it for somebody else or with a song or so. But the one on SelfHelp4Trauma is very easy to follow, actually. So the only thing you do is tapping like 10 to 15 times on each of these 13 points while activating whatever it is that bothers you. And remember, don't go in deep into that. Just keep it slight, because the mind knows directly what it is that you want to reach, and that is exposing yourself to that memory, which has an emotional often negative component or charging component, I would say, not negative or positive, but a charging component that gives this reaction in the body, because the reaction will come in the body. I mean, it's not the thought that is the heavy, it is what comes into the body.
Yeah.
So that is that okay?
Yes, that was great. You're welcome, Rockwider. Are they specifically targeting veterans in this segment? No, Akri, we're not specifically targeting veterans. I just put that hashtag on there because I like to invite and let veterans know that there is help for their PTSD, and this type of technique could help them.
And I could just add that
Go ahead.
My mentor, Dr. Carl Johnson, who I went with to Rwanda the first time, he had been working in the VA hospitals, in the Veteran Administration hospitals for 25 years when I met him. And for him, he said that it was when I learned this technique that my patients, those who came to me for having help, really got healed. So he found this technique, and that's why he told me early, like in the beginning when we worked together, that, focus on trauma, because few people can help those with trauma, and this technique really does that. So I could really encourage your follower there to try it out,
Yes,
because it has helped many. We don't promise anything.
Yeah, and
but we have seen a lot of things happening.
A lot of one of the comments that came up in the crowd here is that our VA system here is not as helpful to all of the veterans as they could be. And there have only been a few select veterans hospitals that have brought this program in to help people. Go ahead. Were you going to say something? Yeah. And so I think some of the followers, what they should do is go to SelfHelp4Trauma.org, and they can check out the technique on their own and practice it on themselves, is what you're saying, right? It's that easy to learn. That's
the whole idea. The whole idea is you don't need more than that movie. That movie is enough. We know people. We know there was a guy who came as a refugee from Syria to Sweden, and somebody told him to go check out one of our movies. He was having flashbacks, nightmares, typical post-traumatic stress symptoms. And he checked it out and did it for himself, and then he let us know just after that he say it seemed so silly, but it actually helped. He could feel the symptoms, some of them, go away as he was doing it, and it sounds too good to be true. But we've been doing this since 2007. Mm-hmm. It's something you simply check the movie, try it out, and you will have an effect.
Well, I know it works because I've used it on myself. I'm a daughter of a Vietnam vet, okay, a Marine, in the Marine Corps for 27 years. As you can imagine, my life growing up with someone that had PTSD was basically having PTSD, right? I got PTSD living with someone like that, So I've, over the years, been able to heal myself from that with different techniques like this. And then, of course, just maturing and growing and changing and finding other techniques to help myself. One thing that I wanted to get out there before we have to go, because I know you guys have to go, is one of the main things that I love about this technique, and you touched on it just a little bit, is it's non-invasive. You do not have to talk about the situation. You do not have to say it out loud. For 5 of us here, thank you. What it's helped you guys with is the language barriers that you guys might be dealing with in different countries. So can you touch on that just a little bit before we have to get going here?
Yeah, I mean, there is no need because the only thing the brain needs is to expose yourself in your thought, because it is like, the what you can say, the fantasy and reality, the brain sees no difference in it. So when you think about that situation, you are there. And verbalizing is not necessary. And we see that very helpful in both for language reasons, but also because of many people don't want to relieve what they have been what they have experienced or what they have made other people experience, because there is often both. It's easier for people to, to seek help for things that they have been victimized by, somebody has done something for it to you. But when you have done something to others, that's much more difficult. So we work a lot with also around shame. I mean, women who have been subjected to gender-based violence, being raped, they don't want to talk about it. In some cultures, it's just not, you just don't talk about your problems. But for these former child soldiers that we worked with in Eastern Congo, for them also or prisoners, or, everywhere we see, they so much appreciate, I actually don't have to speak. I can stay with this. And if you want to tell, that's not a problem. It's just that it's an option that you actually can stay with your own experience and still heal. Because in the West, it is seen as if you have to tell your story to be able to heal. But we see it's not necessary.
No.
It's not necessary. And perhaps after, when you have calmed down the nervous system, it will be easier, because many will say also, I don't know about this technique, but it makes me want to talk. Also things that you have kept secret before, that you actually want to talk afterwards, because then when the emotion connected to that situation is, has decreased, it is much easier to speak out, whether it's something that you have, been through, or something that you have put other people through.
Interesting. Okay. Wow, we've had a lot to talk about. I cannot wait to get to know you guys more over time. I know you guys are very busy, and with your days just starting over in Sweden right now, it's probably close to 9:30 in the morning over there. And I want to thank Ulf, Sandstrom, and
That's right.
Gunilla for joining. Hamne. For joining How We Heal with Dr. Maria today. There's so much to talk about. Maybe we could do a part 2 session sometime.
Yeah,
absolutely.
So we had some great questions today. I'm going to go ahead and turn the camera around. I want to thank you guys for joining How We Heal with Dr. Maria. And again, I want you to take a look at this website right here. I think we're catching it all there. Right there. Go ahead and take a snapshot of that if you need to. Send it out to everyone. All of my shows are in replay on catch.me. And good job, Rock Writer. And you can go ahead and catch the replay there. Please drop those hearts for me. Drop those hearts. Show me the love. Show me the love. Thank you for those green hearts. And thank you guys so much for joining the show. And stay tuned for the next How We Heal with Dr. Maria. Thank you.